To help us take a retrospective look at the health sector, especially in the last 2 years of President Bola Tinubu, we have joining us a medical doctor and social rehabilitation expert, Dr. Oludare Marindoti. With him is the Lagos State Chapter Chairman of the Nigerian Medical Association, Dr. Saheed Babajide. Gentlemen, thank you very much for being here. Let me start with you, Dr. Babajide. Give us an assessment of Nigeria's health sector as it is currently, especially in the last 2 years of President Tinubu's administration.
Thank you, viewers. Thank you. The health sectors have not really improved so much. It's like the inflation they are talking about, reduction in inflation. And what happened in inflation, you just have a slow lowering of inflation. Not that there's a drastic reduction in inflation. The same thing is going to happen. The same thing is happening in the health sector. There are no significant improvement in the health sector from this administration. And they have shown that the health sector is not a priority of this government. And in the sense that we have had several strikes, the health sector, and also the health delivery is not something to appreciate, because like the health insurance is still low, like 5%. There's no improvement. Healthcare delivery is still low. That's why people still go outside the country to get health service. Even in this country, we know that the former president, the past president of this country, former President Buhari went outside. The former head of state, General Abubakar went outside, and TRC is still going outside. Even the president also, President Tinubu also will go for vacation, go outside. It's unfortunate. It shows that there is no improvement in the health sector, and there are no indices that show that such improvement. And we are still at the same level. That it's not growing. And unfortunately, the government is not looking at what are the causes, what are the challenges, and how to resolve the challenge. What we hear the government is doing is just to commissioning some relevant projects, which may not have much effect on the healthcare delivery. They do more of things that relate to international partnership, researches, and data. That's not the thing we need more. We need data, we need research, but the main thing that we have fed the healthcare delivery, so the citizen, that's the most important thing, which the government have not really done.
All right, Dr. Marindoti, let me. Dr. Babajide talked about commissioning of projects may not have much impact in the sector. That's assessing this administration still. I want you to take it from that angle. Investment in the sector. How has this administration utilized the increased budgetary allocation to the sector to improve in infrastructure and services across Nigeria, particularly in the rural areas, and welfare of healthcare practitioners?
Yeah, thank you very much. We cannot talk about 65 years of healthcare and focus just on the last 2 years, right? So it is a long-term decadence, and it is also something that, a 2-year investment, while it might go further, even some of that money might have not been fully, exhausted. So, yeah, some of the projects might not seem to have been reflective. But when we want to look at the problem of healthcare in general, we have to look at it from a global point of view. It all started in 1966, I believe, when the federal government decided to federalize all the, teaching hospitals and universities that we had, which meant that there was so much control in the center, and then the people in the respective, regions and the hospitals lost control, and they lost administrative, direction of their. That was actually the primary thing that that cause the problem. Infrastructure is something that we definitely need. There is a dearth of infrastructure in our health sector, but it will also take time. We have to understand that it's only a percentage of the GDP that the government can invest, right? And so if the GDP is small, if the country's economy does not grow, we are going to have very limited amount of money that we can invest in health sector, in building infrastructure and all of that. But one thing that is also like, beleaguered our health sector is something that, Dr. Ranka also can, allude to, which is the issue of the number of medical doctors. My father was also like the NMA chairman in Ondo State in 97, 98. And back then, the schools, the universities decided the number of people that they could admit. And yes, we know that the infrastructure in those universities were not enough, but from the concrete, the rose petals were growing and we were thriving. We had the numbers. But about when I was in part 3, I think 2008, 2009 set, I heard President Obafemi talk just now. I believe the negotiation started during him, and Dr. Lainka will be able to say more about this because I was in medical school then. They decided to start to gazette or to reduce the number of medical students, that not just medical students, doctors, nurses, pharmacists, all of them, that each universities can admit. That is 18 years ago right now. So imagine the fact that my set was 300 students, but after then it was about 100 students, and not all of them will still graduate. So we have undertrained for about 20 years. The doctors, we have not done it at the rate. Maybe not, let me not use capacity, but at the rate that it used to be. So should we be surprised that we don't have doctors and nurses right now to attend to patients? And this is one thing that the administration, I have to give kudos to Ali Pati, because not a lot of people were focusing on this. He actually tried to, pull it back, but I believe they've not even done enough. I know there's a case of some people in Calabar that they are still trying to say they were illegal, even though they are passed. So these are some of the problems that the situation has faced. And also a major problem in infrastructure that we have to talk about is the fact that the federal government is also funding inefficiencies. All our federal government-owned hospitals are inefficient institutions. The federal government guarantees their income, but there is no key performance indicator for them to follow. There is no enforceable, deliverables. Right. So the federal government does not focus on any of the private sectors who are the ones that might, train in these places and move to the local areas. They don't get enough funding. NHIS is nothing to write home about. It is essentially moribund. So these complicated situations would have caused the problem. So we can't fix it in 2 years. That's what
Joe, we can't fix it in 2 years, but something can be done. And I mean, on October 1, the president is expected to give the country some, assurances and, maybe explain some of the things he's been able to do in the past 2 years. Election year is just around the corner. So this is, as much as it is a review of our history, it's also an assessment of what could have been done. And that was why I referenced the fact that Dr. Babajide talked about the commissioning of some projects, and I'm wondering how that is, helping the case of their interest in the health sector. But because of time, I'll just ask Babajide, from the report that my colleague gave to us, Sumayya, one of the respondents talked about the NHIS that you mentioned, how it is being used, how sometimes when they go there, instead of giving them the drugs, they tell them they don't have it in stock as an excuse for them to go out and get it. What is your thoughts on how government can make it more accessible for people so it doesn't look like it's the more you look, the less you see?
Yeah, thank you, unfortunate people. If you look at this NHIS and the Lagos and all the states that are doing this, they focus more on the civil servants. And when you see the formal sector and the informal sector are not really being used to get this NHIS, because the main basis of the health sector now all over the world is to get health service out of pocket. That's why they want to make it compulsory. But what they're supposed to use, they're not using it. For example, NHIS has been the same thing from the time they started. They don't improve it. And they are saying they don't drop. How can they have drop? When the budgetary allocation to health, we are still at the level of 4 to 5%. And there's an Abidjan declaration of 2001. How many years ago? About 24 years ago. That the declaration of 15%. And that means that the health financing is poor. And who is going to get those drugs? It's not the government will provide the necessary monetary allocation for them to get the drug. For example, the health premium they are giving people in terms of this healthcare is simple. It's like for example, give example of malaria treatment. The health provider, how much are they giving them? The people to buy anti-malaria at about 3,000 or 4,000. How much are they give them the premium? Even the amount they are giving them, you cannot treat malaria. To talk less of treating anything.
There is indeed a lot of challenge in that area. We're time constrained, otherwise I would want to, I'm sure our viewers would also want to listen more. But let's quickly give Dr. Marindoti at least 40 seconds to take on two critical areas that you think this administration can take on in the next 2 years or before the administration ends, depending on what the outcome of the next election, to make an impact in the sector?
Yes, the first of, you cannot build a skyscraper on a quicksand. They need to change the structure. The federal government has so much control. There was a strike in my alma mater last year where people were sacked because if you want to employ people, you need to go and get permission from federal government. The federal government needs to get into the business of financing healthcare and not controlling hospitals, which is also what Dr. Oludare spoke about. If they can do that major restructuring, the investment will come, with time. As our GDP gets better, we will have more money to get, into healthcare. Like Yoruba people will say, the money you don't have, you can't spend it on your diarrhea. So we need to make more money first, but they need to restructure so that money, when it comes, it will be properly and efficiently used.
Thank you very much, doctors, for speaking with us. We appreciate your time.